I think it's probably time that we get started. I'm Dusty Ferentz with the Kings County Farm Bureau. And I just want to take a second to thank all of you for jumping online and checking out our Ag Employers Resource webinar. And I need to give a big thanks to Teresa at AgSafe. She really helped pull this thing together. And like every webinar I've attended, there's been some technical issues. We're going to have a few more folks join us as we get started. But to Teresa's credit, we're going to record today's webinar and make it available to people after the fact. So with that, I think I'll turn it over to Teresa.
Thanks, Dusty. I really appreciate it. And thank you all for joining us today for our COVID-19 Ag Employer Resources Forum. We've got a great panel for you today. We'll be talking about vaccinations and boosters and testing with Kings County Health Department. We also have with us our friends over the Kings County Workforce Development Center and also the Valley Community Small Business Center. And I'll also be talking a little bit about what's going on with Cal OSHA and employer requirements around COVID. Once again, I just want to thank Dusty and Kings County Farm Bureau. And then also, I know that we've got Sandy on from Tulare County Farm Bureau. And also want to thank Tricia for your support of this program. And of course, it wouldn't be, we wouldn't be able to pull this together without some really great funders. So thanks to the folks over at Together Towards Health for supporting us and getting information out to all of you. So with that, we're going to kick off the program with the Kings County, our health department. So I'm going to hand it over to Layla Lugoski and Nicole Fisher to start us off and tell us a little bit about what's going on with COVID and in Kings County and what resources are available. So with that, we're going to just do a quick change, and I'm going to stop sharing and hand the controls over. So hold on one moment as I make this happen. Okay. And Mr. Lugoski, if you want to take over and start sharing your screen.
I will, thank you.
Great.
So good morning, everybody. My name's Everardo Legaspi. I go by Lalo. I'm a program manager with the Department of Public Health. I'm gonna share with you all some of the information that we have on our website, which pertains to the current status of cases, COVID-19 cases in Kings County, as well as our vaccine and testing schedules. So I'm gonna put what you would probably already know, our website address on the chat, which is countyofkings.com. I'm gonna start sharing my screen, excuse me, so you can see what I'm referring to. So on the main county's website, which is the public facing aspect of it, at the very top, you can see our public health COVID-19 link. You can also access this directly by typing in kingscovidinfo.com, and it takes you to the same page, right? So on this page, we have links to our dashboards and guidance on the left-hand side, as well as vaccine dashboards and information. And most of the information that I'll be covering today, in particular about the number of cases that we have in Kings County, could be found here on the dashboard. So I'm gonna go ahead and leave this up for you all to kind of view what I'm talking about. So, and one last thing is that this website is updated Monday through Friday. We implemented that change. We still update it 7 days a week, but that was just quite a bit of work. So now we update Monday through Friday, and on Mondays, it's kind of like a catch-up day. So the numbers will be higher because we're reporting of the cases that came in over the weekend. We received notification of cases 24/7. So with that said, since the pandemic started here in Kings County, there have been 24,117 COVID-19 related cases, including 314 deaths up to today. This number does exclude the prison populations, which we track separately on our website, and you can see that we have those on the, maybe not exactly on this page, but on our public health COVID-19, they are listed separately, okay? During the week of October 11th through the 17th, we had 470 new cases, which is just over 100 cases more than the previous week. And we've seen another slight increase in case counts among the 0 to 11 and 12 to 15-year-olds. So we're monitoring that trend, which is consistent with children being back in school and whatnot. So, excuse me, the most recent surge, which we track as having started on July 1st of this year, there have been 7,210 new cases. This accounts for almost 30% of the total cases in Kings County, which is just over the last 4 months, which is about 1,800 cases per month. During the previous 16 months of the pandemic, since March until up until the end of June of this year, the average case count per month was about 1,000. So the most recent surge, there has really been a greater number of cases, most likely related to the Delta variant. So currently, we have confirmed 318 Delta variant cases in Kings County, and in California, there have been 114,211 cases reported. So that number probably greatly misrepresents the actual count, because to verify that a case is related to the Delta variant, they have to do a genomic sequencing, which takes a while longer than the regular PCR tests to identify COVID and whatnot. So there's a large backlog for them. Additionally, for a specimen to be submitted to be tested for Delta 19, for them to do the genomic sequencing, there have to be certain requirements that have to be met as far as like the patient's symptoms and whatnot, which not necessarily all individuals infected with the Delta variant will exhibit all of those symptoms, right? So you know, just putting that caveat as far as what's been confirmed related to the Delta variant. Currently, as of October 25th, which is just this past Tuesday, the local hospital had 46 patients admitted and 7 in the ICU as they relate to COVID-19. Of those admitted, total of the 53 people admitted, 48 were actually Kings County residents. And since July 1st, this most recent surge in cases, 89% of the cases hospitalized have been individuals that are unvaccinated. And that's about 351 out of 394 hospitalizations. And of course, 11% or 43% of those other individuals had been fully vaccinated. So these are individuals that have been going to the hospital, right? Overall, the breakthrough rate in Kings County is at 1.8% of fully vaccinated population. So that's a level that indicates that the vaccines are actually effective at, you know, keeping people from becoming seriously ill or being hospitalized due to COVID-19. So again, I just want to point out that this information is updated on our website. I actually often look at our community cases, because that, you know, that demonstrates our surge and the waves, as they're, you know, also referred to. And I think it's like visually clear to see that this most recent surge, though it didn't have as high a count of cases on a daily basis, a pretty high count on a more consistent basis. And you can see that the slope is actually not as steep as the other surges. So, you know, if we don't do anything additional, if we don't take additional measures, this trend is going to continue, which might roll into the next surge and whatnot. So just wanted to illustrate the importance of using whatever tools we have available to prevent the spread of the disease. And with that, I'll pass it on to Nicole, who's going to discuss our testing and vaccine efforts. So Nicole, take it away.
Great, thank you so much, Lalo. My name is Nicole Fisher. I'm the Nursing Division Manager at Kings County Department of Public Health. And Lalo's going to be handling the controls for this next part. So I'm going to be talking about our vaccination efforts and our testing efforts in Kings County. And as Lalo mentioned, that is all on our website, and he's showing that now. This is where you can go exactly to sign up to a vaccine appointment. It's on myturn.ca.gov, and that is also for booster shots, and it's also for flu shots as well. So I kind of wanted to start out by listing all the things that we have to be responsible for now, and it really is a lot of things. So we're entering flu season, and we have flu vaccine available at our clinics, as well as you've probably seen Costco and Target and Walmart and our pharmacies, clinics, and providers in our community. It's a lot of responsibility for us to do all of this. We have COVID testing requirements for work. We have vaccine appointments, and now flu shots. So all of that you can find on our website, just for one place to go and to sign up for vaccine appointments or COVID testing as well. So why do we get vaccinated? Basically, for the COVID vaccine and also for the flu vaccine, we do it for ourselves, for our family, for our community. We vaccinate to stop the spread to our friends and family, and especially to people that are more at risk. So elderly people, very young people, and the people that work hard to keep our communities safe and open. And I think all of us know, but it's important to just go over that with vaccination for COVID, your chances of being hospitalized with COVID-19 become almost zero. As Lalo mentioned, the numbers of people that are hospitalized that have been vaccinated is very low compared to the people that haven't been vaccinated. When we vaccinate, our COVID-19 cases decrease, and our schools and businesses stay open. And it's basically allowing us to get back to all the things that are important to us and that we care about. So every week at our Board of Supervisor meeting, we have our interim public health director go over a lot of our numbers. I'm just going to kind of give you an update on our last week of vaccines. So last week, for the week of October 18th to 24th, public health, so our clinics specifically, administered 427 vaccines, which is a bit of an increase, and it could be due to the fact that booster vaccines have been approved for Pfizer and Moderna for certain eligibility groups. So as you probably know, the FDA and the CDC and the Western states have made recommendations for Moderna and Janssen COVID boosters now. We have approval for, oh, and I'm sorry, I think I said Pfizer and Moderna. We just have right now Pfizer approval, but we began administering those on Monday the 25th for the booster shots. And if you received Moderna or Pfizer, the eligibility requirements are the same. So this includes people that are 65 and older, people that are 18 and over who live in long-term care settings or institutions, have underlying medical conditions, or who work in high-risk settings. And for those who originally received the Janssen vaccine or the J&J vaccine, everyone age 18 and over vaccinated at least 2 months ago is now eligible for a booster. The CDC recommendations, which we follow, as well as the California Department of Public Health, allow for cross-vaccination or mixing and matching your doses for booster shots. So if you were originally vaccinated with Pfizer, but you have only Moderna available at your appointment, you can be vaccinated with Moderna. And right now in Kings County, we have the 3 vaccines available. So that is really great, because early on we didn't have that luxury of having all 3 vaccines. So it is more likely that you can pick the vaccine that you were originally vaccinated with for your booster. So if you, just as a reminder, if you've had the Janssen vaccine, that's the 1 shot, then you have to wait at least 2 months after your initial dose to get a booster. And then for Moderna and Pfizer, after your 2-dose series, it's 6 months after that you can get the booster. Yesterday, so you've probably seen this in the news, the FDA reviewed data on the safety and efficacy of the Pfizer vaccine in children ages 5 to 11. So the FDA did grant preliminary approval. It does move over to the CDC and to the Western State Advisory Committee for their next consideration. And we have been asked by the state to pre-order our pediatric Pfizer doses. So we could be receiving those as early as November 1st. So this is all contingent on this vaccine for that age group to receive the emergency use authorization. So COVID testing continues to be offered through our clinics and mobile unit. We did, if anybody has come to our Hanford clinic, we did make a change because of the rain earlier this week. So you'll see us right at Lacey, right at the front of our building. So we are still continuing to do that, and our mobile unit is has a schedule throughout the community. We administered last week 1,959 tests. So that is a little bit less than the week before, but a lot of that has to do with school requirements and work requirements. So we still have a large number of people that are testing weekly. We definitely encourage anyone who has symptoms, or if you know that you've been around somebody that has had COVID-19, to test. And it's really important that if either of those are happening, you're symptomatic or you've been around somebody who has COVID, that you really stay home and really monitor your symptoms. We know that the cold is here. We know that the rain is here. Flu season is starting. So it's really important to remember to stay home if you're sick. Please get your vaccine and test regularly, especially if you're in a high-risk setting or around people that have had said they have had COVID, because we really want you to stay healthy and to stay safe. Thank you.
Cool. Thank you so very much. That was great. I had a couple of questions for you, if you don't mind.
Yeah, of course.
Okay, so one of the things that we've all been struggling with, I think probably since the Delta bloomed and lots of more people were testing positive, is finding access to those testing sites. And so right now with your mobile testing sites and your other areas where you're doing testing, what's the turnaround on getting test results back? I imagine it's for the PCR test.
Yes, that's a great question, Teresa, because with this last surge that we've had with cases, as Lalo mentioned, we've had more people testing, and there has been a backlog with the processing of those tests. So we send them out to be processed. So it was taking up to 72 hours. Right now it's between 24 and 48 hours for getting those tests back.
Okay. Oh, that's great. That's good to know. I also know that I've been hearing too, with some of our employers that have been doing the rapid testing, trying to get their hands on those kits has been difficult. Is that something similar to what you're hearing in Kings County?
Sorry, yes. So it also is difficult. The rapid tests, they are available at certain clinics. And I know that individuals are traveling, like if you're in Kings County, traveling to Tulare and Fresno County for those tests. But I think as we continue through, we see these periods where it's really hard to get the test, or it's the processing is longer for the PCR. But I find that now that our cases are starting to come down a little bit more, that there's more access to those, and it's a quicker turnaround.
Okay, that's great. Thank you. And I think my last question, and if anybody else has questions, feel free to jump in. I mean, like, you got experts here, so take advantage of this opportunity. But so we've got employers here that might be interested in getting vaccines for their employees. What's the best route for them to kind of gain that access for their employees? Because honestly, going to My Turn is a little bit it's a little cumbersome, especially if you've got several people that are interested. So are there any resources available for, say an employer that's got, 5 or 6 employees that would like to get vaccinated?
Yeah, so early on, when we received the vaccines, we were able to go out and do like more of a little bit larger size businesses. We were able to take our mobile unit or send out our staff. There are, as Lala was putting up, or I think maybe you put this up too, Teresa, that there are these extra clinics that we are doing, and we're getting assistance from the state to help us with the vaccines, administering the vaccines. So it's something that, and Lolo, can you talk about, I forget if you can walk up to these, oh, sorry, walk-ups welcome. Yes, it says on that one. So this one is more accessible in that you can walk up and you don't have to go through that process online. They'll help you with that. For larger businesses, we can assist. We go through the state to have them take their mobile unit out to help bigger facilities with vaccine.
Okay.
And if I may add, it's going to have to be registered through My Turn at some point, so either like somebody at the site is going to take the person's information and enter it into My Turn, or somebody can just, do it on their own separately. So it might be, for instance, for an employer that has several staff members, to maybe designate somebody to help those staff people register. That way their appointment's guaranteed. It's rare that we run out of availability for walk-ups. So, walk-ups are definitely welcome and whatnot. And there are, clinics throughout the county available at different times. But definitely it's going to be going into My Turn. That's how the state's tracking, COVID now, and we have to use it as well. So, our staff is really good and they're trained with it, so they know how to go through the forms really quick and, explain whatever the information is being requested to people. So that's definitely helpful. Yet it's, still going to have to go through to My Turn. So.
Okay. That's really helpful. Thank you both. Yeah, and with our workforce, with so many that might be a little afraid to go through government channels to register themselves. So you understand that, being able to provide that additional assistance is really critical. So what I'm hearing is that if you potentially have a larger group of people that might want to get vaccinated, that it would be best to potentially go through Kings County, who would then reach out to the state. Is that what I'm hearing?
Yes, that's correct. Yeah. And if we're able to assist, we will, but because we're doing all of these vaccine clinics and testing, the state has been offering to help us when we have requests within the community. So.
Fantastic. Thank you. Thank you both. Do we have any other questions? I feel like I've been dominating all the Q&A with Nicole and Lalo. And I don't see any. Okay. All right. Well, thank you both. I really appreciate the information. That was really helpful. And are you able to stick around in case there are other questions that come up towards the end? Wonderful. Okay, well then we are going to switch gears here, and I'm going to take over for just a few minutes, and we're going to talk about what's going on with Cal OSHA and regulations. So hold on as I change out and I share my screen. There we go. Hold on one moment. Technical difficulties. I'm on a different computer too, so it is, there we go. Excellent. Let's get out of this and into this. There we go. Okay, so we're going to talk a little bit about COVID-19 employer requirements. There are a few things going on, so just wanted to give you guys all a quick update on what's happening on this front. So what's going on at Cal OSHA? So we just got word that we're currently under the emergency temporary standard. And the emergency temporary standard started in June. It's expected to end in December. And there is another emergency temporary standard round that is going to, it looks like it passed, and that will go from January to April. It's super confusing, I know. And then the Standards Board has come out and said they're going to, they have proposed language for a permanent standard that they are proposing. They've got language out on it now. There was a committee meeting that happened in September to review that language. And it looks like what their goal is to launch that beginning in April. With the permanent standard, it's a little confusing. While it says it's permanent, it is actually, they're putting in essentially a sunset clause into it right now. They were looking at potentially having it sunset after 2 years. They also might look at tying it to the cases. And so if case rates reach a certain level, they might look at then extinguishing the permanent standard. So those things are up in the air right now, and that is what we're going with. But for right now, we are still under the emergency temporary standard, and we'll talk a little bit more about what you need to include in your COVID-19 prevention program. Supplemental paid sick leave. So wanted to make sure that you all remember that it expires for 30th. And so while that has expired, you still need to make sure that you are talking to your employees that if they are not feeling well because of COVID or have COVID, that you're talking to them about their leave options. So we're talking to them about their paid sick leave, if they've got vacation, if it's something that is a longer term COVID related sickness that might have started within the workplace. There's the workers' comp availability as well. So making sure that you're talking to them about all their options in terms of leave, because you want to make sure that they stay home, they get well, and they come back when they have no more symptoms. And all that time has passed that needs to happen. There is also, remember, we've got the recommendations on face coverings indoors for the California Department of Public Health. And then we're also watching the federal mandate for vaccinations or testing for companies with 100 or more employees. Don't have any more details yet. Sounds like there are things that are happening, and we're hearing a little bit of chatter, but I don't have anything definitive yet to talk about. But I just want to make sure it's on everybody's radar. Under this emergency temporary standard, you have your company COVID prevention program. So it's got to be a program that's specific for each work site. I want you, if you don't have one, go to the Cal OSHA website. They've got a sample program available there for businesses to use. I believe they got an English and Spanish. And you always want to use the resources that Cal OSHA provides, because then you know it's going to hit the mark. So go take a look at that. Make sure that you're reading through that and inserting the important information that you've got to provide for each work site, who's your designated person, all those pertinent details. And then as a part of your safety training, you have to make sure that you are reviewing that program with your employees. Make sure that your management knows, make sure that your supervisors know, make sure that all of your employees know what your COVID prevention program entails. That is something that Cal OSHA has been really hammering home, and it's something that they are looking for when they are doing inspections. Elements of your COVID prevention program. So we've got, who is the person that's responsible for the program? How are you identifying and evaluating your COVID hazards? And then how are you correcting them? So what does that look like at your operation? How are you doing those controls of those hazards? Making sure that you are investigating and responding to COVID cases is something that we hear the state talking a lot about. That is one of the complaints that employees have had across industries, is that my employer is not taking this seriously. And so that's when Cal OSHA will come in and do those inspections. You also make sure that you need to have a system for communicating. So if your employee is not feeling well, who do they go to? Who do they talk to? So making sure that you've got that in place. Your exclusion of COVID cases, how are you handling if you end up having a positive COVID case? How do you then go about working with your other employees who might have been exposed to that COVID positive case? What does your work return criteria look like? And then really critical is making sure that you are doing the reporting and record keeping and your access, making sure that you've got those dialed in as well. And then what does your work return to work criteria look like? So those are the elements of your COVID prevention program that you need to have in place. And then training topics. So again, this has been really critical as well. You need to make sure that you are talking to your employees about COVID-19 and how it spreads and how it's transmitted. What are your indoor risks and controls? The importance of frequent hand washing, and make sure that you've got extra hand washing stations available. Supplies are replenished. You've got plenty of soap. You've got plenty of towels. You've got your trash cans ready. Your proper use of face coverings and when they must be worn in the workplace. Make sure that you have face coverings available for your employees. So always have a stash of them available and ready. So that is really critical. Here's another critical piece. We talked a lot about in the emergency temporary standard, they've talked a lot about respirators and N95s and also having those available for your employees. So there's one thing to provide them for your employees, but you also have to do the second piece of this and teach them how to use it properly. So I've got some resources that we'll talk about at the end of my presentation, but you want to make sure that you are also training them on how to use them. You are also talking about what COVID-19 symptoms are, the importance of obtaining COVID-19 testing, and not coming to work if your employee has COVID-19 symptoms. You're reviewing your company's policy for how to access testing and vaccination information. You're reviewing your company's policies and procedures. You are informing, you're providing information regards to benefits to which the employees might be entitled to. So as I was mentioning, that are applicable under federal, state, or local law. So making sure that you're talking to them about their sick time availability. If it's a workers' comp issue, that you're helping navigate that with them. It's important just to have lots of communication. And then any other employer-specific information. One other thing I want to make sure to tell all of you is that it's really important to make sure that, again, you are working with your employees. You are continuing to do those health screenings prior to employees coming in. So if you can potentially stop a worker from coming in with a temperature, that has a huge impact. And so the times that I personally at AgSafe have had an issue arise is, that time that an employee did not turn in their health screening. So just make sure that you're doing those on a daily basis. And then finally, we've got lots of resources with AgSafe and the Western Center for Agricultural Health and Safety. We have developed tailgate kits available English, Spanish, Hmong, and Punjabi. These tailgate kits talk about what COVID is, what COVID protections are available. And the great news about these tailgate kits is that they have been reviewed by the state. They meet all their mandates. And so these are available for all of you. If you are interested in getting a tailgate kit to train your employees about COVID-19 prevention, please let me know and we'll pop some in the mail to you. Like I said, we've got them in multiple languages. So just trying to make sure that we are taking care of all of you. We also have 3 videos that are being finalized right now in English, Spanish, Hmong, and Punjabi, and Mixteco. They are covering the same kinds of things, but just realizing that sometimes that you guys are in a conference room and doing a training together, and sometimes you are out in the field, and so the tailgate kit comes in really handy then. And we have just also revamped our AgSafe website, so we've got all kinds of resources available for COVID there as well. Also make sure that you're checking Cal/OSHA, going to the DIR's website. They've got, their FAQs are actually really good and help you navigate all the different scenarios that we find ourselves in ag having. And here are some of the resources and that Western Center for Agricultural Health and Safety has available. They've got the COVID-19 How It Spreads. It's a laminated like 11 by 17 sheet. They've got information on vaccines. We are also working with them on a video around N95s and how to properly use them. When I remember when I was mentioning that for COVID, you need to make sure that you are also training your employees. So that video would work for that. It would also work for wildfire smoke protection as well. So look forward to releasing that at in the beginning of next year. And that is all I have. I see I've got a couple, maybe some questions in the chat function. I'm going to check out. And yes, so Misty, yes. So make sure that you are reporting cases. If you got 3 or more at work, reporting them to the county and Cal/OSHA. That is correct. Thank you for that question. And Clerk 2, I'm going to absolutely send you a tailgate kit. If you wouldn't mind just putting your name and also your address in the chat function, we'll make sure to get that out to you. Any other? Oh, you did? Sorry, got that. Okay. All right, so I'm going to stop sharing now. And if you happen to have other questions, feel free to let me know. I'll hang out for a little bit after this presentation, but I'm always available for anything that you might have that you've been wanting to ask somebody, but you know, haven't had the opportunity. So with that, we are now going to hop on over to our business opportunities section of the website, or the website of this webinar. And I'm going to hand it on over to Rich with Valley Community Small Business Center. He's going to talk a little bit about some programs that you may not know about.
Well, good morning. Thank you, Teresa. Wow, what a wealth of information we've had so far. This is fantastic. I hope this is beneficial to all who are viewing this. First and foremost, again, I appreciate everyone on the call and everybody attending. It's important that we stay vigilant and that we continue to just be as knowledgeable and safe as possible. I will say from a personal standpoint, I got my booster shot this morning and I'm still doing well. So life is good. Go get your booster shots if you didn't get them already. For those of you that don't know what a Small Business Development Center is, we are an organization that is funded by the U.S. Small Business Administration, the federal department that helps small businesses nationwide. And we are basically their consulting arm. They contract with centers like mine throughout the entire country to provide no-cost confidential business counseling to anyone who wants to start, grow, or expand a small business. Now, The center that I run is Valley Community Small Business Development Center, as you can see by the logo and the great propaganda in the share box here. And we are very proud to serve Fresno, Madera, Tulare, and especially Kings counties. We are actively involved in the community as much as we can be. And we want to make sure that we are the official no-cost resource for your small business. Now, let's talk a little bit about what a small business is. A lot of people say, well, I'm a grower, I'm not a small business. Well, yes, you are. If you file taxes and you pay for what you're doing as part of that, you are a small business. So we can help you out. And let's not lose sight of the ag-related businesses that are all throughout the entire Central Valley, but especially there's quite a few in Kings County, where if you're a hauler or a pruner or a cleaner or a processor or anything like that that's ag-related, we can help you as well. And sometimes there's a little bit of confusion of, hey, I'm not a Main Street business. I don't have a bakery in downtown. That's okay. Just know that whether you're a traditional brick and mortar, a home-based, an ag-based, and ag-related business, we can help you out. And then the most important thing is that what we do is also confidential. So if you have issues or problems related to your business, let us know and we can help you out. And the way we do that is very simple. I'm the director and I manage the 4-county process, but we do really provide great one-on-one technical assistance through a team of consultants that I hire and I pay for, so that you get the subject matter experts to help you with whatever issues you have. Our services range, the subject matters range from everything to how do I start a business, how do I grow a business, write a business plan, financing, marketing, websites, search engine optimization, social media, all kinds of wonderful things, all the way to procurement and exporting. The truth of the matter is, what we try to do, we really work closely with partners like the Workforce Investment Board and the Farm Bureaus and Chambers of Commerce to know who's providing what services out there. And if we can't help you, we will be a conduit to an organization that can help you and make sure you get the assistance that you need. Again, AgSafe is a great resource that I'm learning more about today, so I'm happy to see them promote what they're doing. The bottom line is, what you can do is just contact us whenever you have an issue. In the last 19 months that we've all survived, we've had to pivot like most businesses, and we really have focused on being at the forefront of understanding, deploying, and assisting with any kind of stimulus-related programs that affect small businesses or that small businesses are allowed to apply for. So right now we're in a bit of a lull, actually, between the state and federal stimulus programs. There is what's called the Economic Injury Disaster Loan Program that is still operational, up and running, and is open until December 31st of 2021, unless the funds run out. And so I strongly encourage you that if you or your business was affected by the pandemic and you had some losses because of that, you can apply for a loan, a very low interest loan, that is only 3.75% interest on a 30-year note with a 2-year deferral, which means you just don't pay it for 2 years. And it can be used for a number of different things, even refinancing high interest debt. That loan goes up to $2 million. They just expanded it out. So we can help you understand if that makes sense for you and should you apply. It is eligible to ag businesses and ag related businesses. So I encourage you to investigate that if that's something that could be of help to you. And we do have counselors who are experts in the field who have done this many, many times with our clients and can help you through the process if you need it. There are a number of different other programs that are either wrapping up or revamping right now, especially with the state of California. They're about to release what's called the Shuttered Venues Operators Grant, which for anybody who has an outdoor event facility or anything like that, you can apply for some money to help keep you afloat. There are some COVID relief grant revamps that are happening right now where hopefully local counties, and I know Kings County is looking at it, Kings County might be able to apply and get money to give out in micro business grants related to COVID damage, and those are up to $2,500. So there's a number of different programs out there that are stimulus related, and we can be your go-to source for that. But also, as we move forward, it's really important to know that we all need to do our best to get back to business. And so therefore, what we're really encouraging is making sure businesses understand that, we may not always see stimulus related money that's low interest or forgivable, but if you do need to expand and grow, there are traditional and even some non-traditional lending programs out there that can help you do that. And we can help you weed through the process and understand what works for you and what doesn't. The most important thing in our service provision is that you just reach out and you ask. And you find out, hey, I need help in these areas. Either we'll do it directly or we'll find the right agency that can help you. And it's very simple, the way it works. You can see on the slide that we have in front of you, all you have to do is go to our website, valleycommunitysbdc.com, and there's a bright green button that says Get Started. All you have to do is answer a couple of questions after hitting the Get Started button, and you're put into our queue, where we look at your needs and we analyze them and we get you a consultant signed within a very short period of time, and you get the help that you need. And oftentimes, with all the different programs that have happened, and even some of the traditional programs you may not be aware of, all it takes for you to move forward and get it done and grow and expand is just that simple helping hand to help you through the process. We are here to do that. And I will always promote us as your best friend and your worst enemy, because we're going to take you by the hand. We're going to show you how to do things correctly, and we're going to tell you if you're doing something wrong, we'll correct it. So the bottom line is, our goal is to just help every single business we can in Kings and all of the South Valley, but for today's subject, we are very happy to focus on Kings County, and give them the tools and the techniques and the support they need to continue to stay in business and to hopefully grow and thrive, so that they take my friend Lance, who's coming up next, and keep him so busy because they're expanding so much. He won't be able to go home at nights, because he'll be working on helping those businesses find their employees and grow in Kings County. So with that, I'd like to just open it up for any questions, if there are any. I will get out of the screen share in just a moment, but Teresa, I cannot see the chat when I'm on screen share. So if you could let me know if there are any questions.
Yeah, Rich, I've got you. And I don't have any questions at the moment. But if you are, you've got, you're thinking about something and you want to reach out to Rich, his information is on the screen. So make sure you do that. Good heavens, the Small Business Development Centers are such a wealth of information. I personally have utilized our Small Business Development Center here in Stanislaus County to help with doing some figuring out my website for a friend and putting together a business plan. It's just been a wealth of knowledge that they have, and it's free. So make sure that you utilize those resources.
Well, thank you, Teresa. And the check is in the mail. Again, we're here to help. And the most important thing is to reach out. Don't be embarrassed. Don't be shy. We've got the people who can help you get the job done.
Absolutely. Rich, thanks so very much.
Thanks. And I'll stay on if anybody has questions later on.
Okay, perfect. And then we're going to hand it on over to Lance, who's with the Kings County Workforce Development.
Yeah, thank you, Teresa. Lance Lippincott, I'm with the Kings County Workforce Development Board, the Job Training Office, and the Economic Development Corporation. Shameless plug for Rich, simply because even though it says Clovis Community College on here, I will say Rich twisted our arm to get a physical satellite location in Kings County, one of the first in the Central Valley. So huge commitment to Kings County from those guys.
Well, and again, with the support of the Workforce Investment Board. That's why I say we've got a team in Kings County of really active people who are working for the small business community. So again, thank you, Lance. Now I have to work harder. I appreciate that.
Hey man, just cut that check earlier. My wife will appreciate it, man. To kind of highlight, we do have some, and we work in concert with the other resources that are available in Kings County for Kings County businesses. You guys may have heard some of the other programs that the Board of Supervisors had authorized previously, specifically the $6 million program that benefited close to 400 businesses with awards up to $20,000 per business. Currently and upcoming, the Board of Supervisors did authorize a competitive grant application under the Community Development Block Grant Program between our office and the Kings County Community Development Agency in order to support micro enterprise small businesses in the unincorporated areas. We haven't finalized the provisions for that program. However, we are waiting on the notice of award, which we're told is going to come at any time. Provisions will be set by the Board of Supervisors. We'll take it to them for their authorization, although it is likely you'll see something similar to what occurred in the past. The funding under that is what was requested, and what appears to be authorized is close to $500,000. So we'll look to hand those out to micro enterprise businesses in the unincorporated areas. And those micro enterprises will be 5 employees or less. At the same time, Kings EDC does maintain a local revolving loan fund. We have been very energetic about offering working capital loans during COVID in order to help keep folks going. The commercial loan program that we operate internally, we have up to about $3.5 million. We offer loans from $25,000 to $650,000, depending on the application and eligibility, of course. But we also, during COVID, we've been very flexible, or the loan board has been very flexible in offering deferrals and everything else like that, in order to make sure that people can continue to pay their obligations without being put in an awkward position when they reopen. I will put our website in the chat box. It's super simple, kingsedc.org, but it actually has a loan application contact form on there. Our loan officer, Steve Stone, if you haven't heard of him or met him, Steve has been in the business since time immemorial. He has a ton of knowledge on helping get it around. What's different about this commercial lending program is that we can loan essentially up to 100% on each loan. We have certain situations which will allow us to make loans without down payments. Those are subject to eligibility, but it has been utilized by several businesses in order to keep their capital investment program, or keep their capital up so they can continue during the COVID shutdowns. At the same time, on the Workforce Development Board side, the Kings County Job Training Office does have subsidies available to employers for employees that are eligible and come from our office. Those subsidies can be 50% of the employee's wages for up to 3 months. That is under the Job Training Office on the job training program, or it could be 100% of wages paid for up to 6 months, and then it tiers off to 75% for the second 2 months and 50% for a total of 10 months of the program. Those workers come out of several different funding categories, and that allows us, the funding that is provided on the subsidies allows you to bring these folks on, get them up to speed without any cost to you. Overall, there really isn't a limit on how much the subsidies can be taken advantage of. Again, you can contact us through our website. I think our current largest subsidy out is about $90,000 to a single employer, but that is available if you would like to take advantage of that program. Finally, I know it's been tough right now. Our workforce population dropped off significantly pre and post COVID. There is an ability, and the Kings County Job Training Office is conducting several incumbent worker trainings. What those are is you have current staff, and where they're looking, say you're missing maintenance mechanics or anything of that nature, we can retrain your current staff, get them certified in the new position, so long as it's coupled with some sort of uptick in pay and stuff like that. We pay for the training, you pay for the wages for them to attend. It helps get you position folks in wherever you need them. We're very lucky. Our 2 main trainers here are our community colleges, West Hills College, Lemoore, and COS. They are very flexible. We can get programs up and running in as little as 2 weeks, which I found incredibly helpful. But that is also an opportunity. Funding for that is very limited. We're a small area. We can only use 20% of our funding, about $200,000 per year on it. But if that's something you're interested in, drop us a contact form at kingsedc.org. We would love to follow up with you guys, or even come in the office. We're always open for contacts. Past that, if I will put my personal email in the chat box, please feel free, if you're ever interested in incentives or anything of that nature, COVID support, please reach out. I have a couple folks. One of them is an awesome lady. Her husband owns a landscaping company. Calls me every day. Really awesome. Feel free, email me. We're always happy to reach out. That being said, thank you, Teresa and Dusty, for this. This is amazing. Great info.
Lance, that was great information. Okay, so question actually for you and Rich. What have you seen in terms of the ag industry utilizing your services? Has it been such that you think you could see more? Like, we just need to get the information out. What do you see? What's the trend?
Lance, do you want to take it first? Or?
Yeah, ag's one of those. I come from, my background is ag. My family's all been ag. I know it's sometimes hard to break into that community with some of this stuff. I will say some of our larger, Olam, Del Monte, a couple other ones, they've been really active in taking advantage of the incumbent worker training program, retraining maintenance and production workers into industrial engineers and stuff. It's been fantastic. So a lot of possibility there. Always open to new ideas though.
Yeah. And to piggyback off what Lance says, is I wish we would do more. I really do. One of the frustrations we have is sometimes people in general connotate small business as non-ag, and that's just not true. And so it's very important that we continue to keep reaching out and trying. We've had a lot of great growers and ag-related businesses go through the pandemic and survive because they got loans or grants or things that are associated with that. But also in general, if they just want to expand or they want to diversify or they want to create a value-added program where they're canning their products, we can help them understand how to do that.
I appreciate that, Rich.
Our way, please.
Yeah, no, absolutely. And you're not going to end up on a list somewhere. This is, now you're not going to be targeted for, government's going to come after you. These are programs that are funded by our taxpayer dollars, and utilize them. So
as such, Lance and I have very strict confidentiality rules, and we follow them to the T.
That's great to know. That's great to know. Well, thank you both for everything that you do in supporting our communities. We really do appreciate it. I'm going to check and see if there are any other questions in our chat. Everybody's been a little quiet as of late. Yeah, I don't have anything new. So I think with that, we're gonna close this out. Again, I want to thank Dusty and Kings County Farm Bureau. I want to thank Tricia with Tulare County Farm Bureau, and Sandy, who's been participating in, and then all of our panelists for your time today. Thank you again for everything that you're doing and keeping us afloat. We really appreciate it. And thank you for Together Towards Health and supporting this program. Thank you all. Have a great afternoon and stay safe. Bye-bye.